Hello, welcome to a medical alert from the American Association of Kidney Patients, titled AAKP Medical Alert, Understanding Secondary Hyperparathyroidism, Its Treatment and Possible Treatment Changes in 2021. My name is Erin Kale, and I am Director of Stakeholder Operations for the American Association of Kidney Patients. I oversee our patient education and grassroots engagement activities, including our Ambassador Initiative, which comprises highly motivated and engaged patients and caregivers around the country and the globe. These individuals have a direct connection to kidney disease and wish to raise awareness and provide support to others navigating the challenges of this chronic disease. AAKP's HealthLine webinars fall under our Center for Patient Research and Education. We believe patient and caregiver education is an integral part of treatment and protection of patient lives, and we work to ensure that the patient has a central role in research and guidance that are designed to determine optimal approaches and strategies for providing healthcare services, assistance programs, and access to new products and services. I'd like to introduce AAKP's President, Richard Knight, and invite him to say a few words. Richard is a transplant recipient who spent time on in-center hemodialysis. Richard?
Thank you, Erin. And thank you, everyone, for joining us today as we share a special medical alert about medications that many of us take to help manage secondary hyperparathyroidism. As you know, the mission of AAKP is to educate and advocate by bringing patients to the table for important discussions about their health and promoting community, especially among minority and underserved communities. We work with Congress and the federal government to further research on early disease detection and on the appropriate diagnosis of rare and genetic conditions. And we work closely with our colleagues and industry partners like Amgen, who you will hear from today, to provide important up-to-date information about treatment options. And we work together to ensure kidney patients are equipped with questions to ask their healthcare team and ensure that their voice is heard. So I am asking all who are listening to stay connected to AAKP and to share your involvement in our online efforts. Because although our reach is growing, we believe that there are many others who would benefit from our resources. So having said that, please be sure to follow us on social media and share our posts with your friends and colleagues. I will now ask my fellow transplant recipient, AAKP Chair of Policy, Global Affairs, and immediate past President, Paul Conway, to talk about our survey research that led in part to today's call. Paul?
Hey, thank you very much, Richard. Richard Knight and I have traveled similar paths for many years as dialysis patients and kidney patients, transplant patients, and we appreciate the work of our industry partners in Amgen, support of AAKP. Leading up to today's webinar, AAKP engaged in some survey research, flash surveys, that we use when we're working on public policy issues of patient access to medications. In 2015, AAKP founded our Center for Patient Education and Research, and through this office, what we do extensive research on issues that patients identify as important to them. And one of those issues is secondary hyperparathyroidism and the access to timely treatment. So what we asked in our flash survey related to today is, if you're taking a medication to treat a medical condition such as hyperparathyroidism, do you feel that your medical provider, either physician or dialysis provider, has the right to change it without your knowledge? And we asked this question. You can see the result. 86% said no, because AAKP has long advocated for patient care choice and an informed discussion between doctors and their patients, and to make certain that doctors and patients together are arriving at the correct solution. So in particular, on this question, we asked if a medication were to be changed for your current treatment for hyperparathyroidism, and it was done so without your consent or any discussion with that patient, would you do that as a violation of your patient care choice, and that your voice and potential concerns were ignored? And while this may seem obvious, the number here is pretty stunning, because the number of patients that suffer from this, we think, is widely underreported. and it's a very critical issue to how patients feel on a day-to-day basis. This condition be treated and treated well, and the treatment decided upon by the doctor and the patient. So patients would see this as a violation of their care choice. And so this question here was put on to basically go out and ask the broader question as patient consumers, whether or not as patient consumers beyond simply having a whole series of medical conditions, do you think in general that patients should have a voice in care choice and treatments, and how that impacts you as a healthcare consumer? And what you can see across these three questions, we call this bracketing, is that patients feel as though, of course, they should have a voice in their treatments, they should have a choice in their treatment, and especially so when it comes to treating secondary hyperparathyroidism. And so we put this at the front end of this discussion because, one, we're trying to educate patients on what their options are. Two, we feel very strongly that patients and medical practitioners together can come up with the best solutions for them, and that those solutions should align to what the patient wants to do in terms of their career, their family, and other things like that in their life beyond the disease. This particular condition can affect your mood, can affect your energy levels, it can affect many different things, and it has to be addressed. So we appreciate your attendance today and your attention to this, and we thank again Amgen. Erin, pass it back over to you.
Thank you so much, Paul. I'd now like to introduce today's special guest speaker, Deborah Dreyer. Dr. Dreyer is a pharmacist with postgraduate training in dialysis and clinical pharmacy work with a nonprofit dialysis provider. She transitioned to Amgen in 2010 in a medical support role and has supported the nephrology community in clinical research and educational initiatives since then. Dr. Dreyer, I will turn things over to you.
Thank you, Erin. I am so grateful for the chance to talk to you today about secondary hyperparathyroidism. I'm delighted to be a part of the long-standing partnership between Amgen and AAKP. We are fully supportive of the mission and the passion of AAKP, and I'm just so thrilled to be able to do a bit of education with you all today. So, as Erin mentioned, my past is in a nonprofit dialysis unit. So I have a great deal of wonderful memories of being in the dialysis unit and caring for kidney patients directly. And then for the last 11 years have worked at Amgen, again, in a different capacity, but still carrying on my compassion and passion for education of the nephrology community. So thanks so much again for having me. What we're going to do today is talk really about the disease state in particular of secondary hyperparathyroidism. So we're going to do a bit of education about that. We're going to talk about its treatment, dietary and medications, and then we're going to talk about some potential changes that are happening. We say in 2021, and that is right now. So we are, halfway through the year already, and there have been some changes that we're going to talk through. And so I look forward to hearing some questions at the end. Like Erin mentioned, if you have questions, please do type them in, and Erin will provide them to me at the end of the presentation. What is secondary hyperparathyroidism, which is oftentimes, quite a mouthful. So a lot of times it is called secondary HPT. So I'll probably use those interchangeably throughout the course of the presentation. But on the left here, you see the organs of the body that we are going to touch on today in one way or the other. So in the abdomen here, you see the kidneys. And that obviously is kind of at the root of what we are going to discuss today. So the kidneys, as the kidneys fail, that is where we are focused, of course. Up here in the neck, you will see these structures. The larger structure in the neck that is white is the thyroid gland. And I'm sure you're familiar with the thyroid gland. from physical exams that you have at your doctor's office on routine exam, they will oftentimes feel your neck. Maybe they'll do it while you're swallowing. That is what they are feeling for, is your thyroid gland. But you see these 4 smaller structures that are right next to, almost looks like they're on top of or in front of the thyroid gland. Those are called the parathyroid glands. So the prefix para, meaning beside or adjacent to the thyroid gland. So parathyroid glands are also in the neck. As you can see in comparison, they're very small. And so you would not be able to feel them in a normal situation just by touching the neck. Generally, individuals have 4 parathyroid glands that sit right there by the thyroid gland. And there also, you see on the right side of the illustration is the bone, and we will talk about the bone a little bit as well throughout the presentation. So when your kidneys fail, one of the primary important functions of many, the kidneys do many things within the body, but one of the important functions of the kidney is to maintain calcium and phosphorus balance within your body. So calcium and phosphorus are minerals that are generally stored in the bone, but are released or taken back up by the bone, released into the blood. And there is a very fine balance that your body tries to maintain. And that is a function of your kidneys. Now, as your kidneys fail and as your kidney failure advances to later stages of the disease, you can imagine then that there is a disturbance or an imbalance in calcium and phosphorus within your body, particularly within your blood. One of the ways that the body attempts to maintain or restore, regain this balance is by causing the parathyroid glands in your neck to make more of the hormone that they secrete, and that is called parathyroid hormone, or you may have heard it referred to more frequently as PTH. So the parathyroid glands make more PTH and release it out into the bloodstream in an attempt to act primarily on the bone, but on other parts of the body as well, but on the bone to restore that calcium and phosphorus balance. Now, as with kidney failure, that is obviously a chronic, long-term health condition. This imbalance in calcium and phosphorus and the resultant imbalance then in the production of PTH is also a chronic condition. And what we see sometimes is as your kidneys continue to have lesser function, we see that the parathyroid glands can grow larger. So you see in that center image, you have what is considered to be kind of normal on the left with the 4 smaller glands. But as they are stimulated more and more and more to produce more and more PTH, you see that the glands start to grow and they get bigger because they are just trying to pump out as much PTH as they possibly can. Now, with that, of course, comes a significant increase in PTH or parathyroid hormone levels. Okay, and this then is what is called secondary hyperparathyroidism. So it is secondary because it is secondary to kidney failure, and the hyperparathyroidism is basically too much activity, hyper, of the parathyroid gland. So secondary hyperparathyroidism in a nutshell is shown on this slide here. And we mentioned the bone, again, being that primary source of calcium and phosphorus that PTH goes to in order to try to normalize this disease process. So we talked about how PTH or parathyroid hormone goes to the bone in order to attempt to capture calcium and phosphorus and bring it out into your blood. So too much parathyroid hormone can make your phosphorus and calcium levels go up. If you think about the bone like a bank, this is always kind of what makes sense to me. It is a bank of calcium and phosphorus. You can make deposits in it. You can also make withdrawals. And one of the things that stimulates that withdrawal of calcium and phosphorus from the bone is parathyroid hormone. So you can see with higher PTH levels, you have more withdrawals and you can have increasing levels of calcium and phosphorus in your blood. Now, this, of course, is in addition to the calcium and phosphorus that is absorbed from the food that you eat. So how do we manage secondary hyperparathyroidism? There is a lot to think about here. We have the PTH and we have the calcium and the phosphorus as well. So one of the primary ways that the providers and the dialysis care team provide education on is diet. Now, this is primarily geared at phosphorus levels, as you are probably well aware. Managing your diet at any point during the kidney disease process is very important. So what we have on this slide are some of the common foods and drinks that are high in phosphorus. Now, there are going to be situations where your dialysis care team will tell you, and that is based on your individual situation, they will tell you which are the good choices for you and which might be the bad choices. So while these are generally considered to be foods that you should limit or maybe potentially avoid altogether, your dialysis care team will tell you, based on your personal situation, what types of food you can have and which ones you should attempt to avoid. So in addition to the diet, again, dietary changes are very important. It is an inevitable part of dealing with a kidney that is not working at its full capacity. Now, almost all of the time, most patients, when we are talking about secondary hyperparathyroidism, and particularly at this stage of dialysis, most patients are going to be treated with one or more medications. That is not necessarily because the diet isn't working. It's just simply that over time, again, we talked about the long-term advancing nature of this condition, you will find that a little bit of extra help in addition to the diet is necessary. So in that case, you may be prescribed medicine, and it may be more than one. So let's talk about the three groups of medications that are typically used to help manage secondary hyperparathyroidism. So calcimimetics are one of them. These are a class of medications. There are two of them that help to lower PTH in the dialysis population. They also have an effect to lower calcium and phosphorus values as well, although the primary reason that these medicines are used is a PTH target. So they are targeting that parathyroid hormone value, lowering it, and with that, then there is some lowering of calcium and phosphorus as well. The other two classes are phosphate binders and vitamin D. So the majority of dialysis patients are going to be treated with phosphate binders. These are a group of medicines that you take at mealtime, and they basically help to decrease the amount of phosphorus that you absorb from the food that you eat. There are also medicines called vitamin D analogs. These are used as well as with PTH as a target. So they are used specifically for hyperparathyroidism to try to lower that PTH value. Phosphate binders, again, obviously their target is going to be phosphorus, and calcimimetics and vitamin D, their target is PTH. Now, I mentioned that sometimes multiple of these medications are necessary based on what is happening in an individual patient. So it could be one of these classes that a patient is prescribed. It could be two, or it could be all three. So they do, while they have somewhat similar targets, and they are all kind of looking at the management of the overall disease process, they do work in different ways. And so a lot of times you will find that one or two or three of them are necessary. And even though they have the same goal, they kind of complement each other, and they work in different ways to reach that goal. So how do you know how you're doing when you have this disease process? How do you know that you are reaching a level of control that is appropriate for you? So your dialysis care team, or even if you are in, say, an immediate pre-dialysis situation, your doctor and your care team has goal ranges for PTH, calcium, and phosphorus that they are monitoring. So in a dialysis unit, a lot of times these are done even a couple of times a month. Sometimes they're just done monthly, and they're, I remember discussing monthly labs with patients in the dialysis unit. So there are goal ranges that they are specifically looking for that have been shown to be the ideal spot for a patient to be for their PTH, calcium, and phosphorus values. So they test these regularly and see if they are within the goal range. That's obviously ideal, or if they are too high or too low. And these lab results are then used by your doctor, your nurse practitioner, the dialysis care team, your dietitian, to determine what interventions can be made. So more dietary counseling, so to speak, to say if there are some adjustments that need to be made. They may be asking you to keep a food log and things like that. If the patient is being treated with medication, potentially another one needs to be added, or one needs to be taken away, or simply a change in the dose of the medication may be warranted. So these labs are what helps the dialysis team know exactly how you're doing on any given month, and then changes are made based on that. So we talked about the treatment medicine groups that are available to treat secondary hyperparathyroidism. These, however, have experienced some changes in this year, 2021. So Medicare, many of you will be aware, pays for the dialysis procedure itself, as well as, some of the medications that are used to treat dialysis-associated conditions, okay? So it's not all of your medicines, obviously, that you get at your local pharmacy or whatnot, but there are some that are grouped into the Medicare payment that is provided to your dialysis unit. So that amount of money that Medicare pays to the dialysis company itself was updated in January of this year. And this may impact some of the medications that are available to you to treat secondary hyperparathyroidism, namely the calcimimetic group of medicines. And so based on the survey that was done that Paul went over with us, I think that the results of that, combined with the mission of AAKP to empower patients and to open the line of communication, I encourage you all to speak with your doctor and your dialysis care team to understand if there is a change to the medicine that you are taking for secondary hyperparathyroidism, that you understand that change and understand why that is the right decision for you. Now, that is genuinely, with any condition, with any health condition, there should be an open line of communication with your provider and with your care team, with any health condition, to understand why your medicine is changing. Now, however, it is more important than ever. And so I encourage you to have that conversation and to understand what is going on with your health decisions. So what can you do if you have questions or concerns about a change in the medicine that you are being given? So managing your healthcare should be a two-way street. It should be a relationship where your doctor, your nurse practitioner, your dialysis care team is working alongside you as a very important member of your own healthcare team to understand and realize the full potential of the treatments that are available to you. You need to understand what you can do to maintain your good health, and your healthcare team, they need to understand and do what they can to support you to the best of their ability. So you should feel comfortable asking questions. They should feel comfortable providing answers to you so that you have a strong shared commitment to your health. That is, again, the mission of AAKP is to empower you to ask these questions and understand the answers and have this open line of communication between your healthcare team to ensure that you are receiving the best care that is individualized to you. So on the right are some examples of questions that you could ask. What medications am I currently taking? This is something that is very important, that you understand what you are currently taking, not only because it's important for you to know and understand, but you also want to be able to tell other providers what medications you are receiving, even if they are medicines that you are getting at the dialysis unit. Why would my medications change? Again, this is very important. It helps you to understand, and it empowers you to know what is going on with your health care, what changes in your labs may have prompted this type of change. These are important pieces to empower you to make better decisions about your own health care. How is my current treatment the best one for me? Again, these all work, the medicines work in different ways, and there are reasons why one may be a better choice for you than another. And so it's wonderful for you to understand which treatment option is the best for you. And this says, after the presentation, I will send you a resource. I believe it was actually included in your initial registration, and I'll show it to you here in just a little bit. But there's an easy to use resource that gives you some of these questions as well as a few others that, again, prompt that open discussion with your care team about your current medicine and the decisions that are being made about your health care. So we talked about secondary hyperparathyroidism. It is a very common condition, particularly in people on dialysis in the advanced stages of kidney failure. It is important to manage this condition just as it is important to manage any other chronic long-term health condition. We talked about the available treatments, including diet and various medicines that might be chosen for you, and the fact that they may be changing this year, and the importance of talking to your doctor about your medicines, about your overall health care, but understanding which medicine choice is best for you as an individual. We want to empower you to do that and to fully understand the best health care decisions that can be made for you. So what else can you do from here? You can obviously go and have a conversation with your dialysis care team, your health care team, in order to understand what is happening with your current care. You can also help others who may be on dialysis and suffering from hyperparathyroidism and share this webinar with them. Allow someone else to learn about the current state of affairs and what they can do to feel that empowerment to move forward with conversations with their healthcare team. You can download the conversation starter. This is what I will show you on the next slide, or maybe the one after that. And you can also stay up to date with health alerts on this issue, among others, on the AAKP website, which you can see there, aakp.org. And as Richard mentioned, there are many resources available to you as a part of AAKP. Encourage others to join this group as well, and realize the group is behind you to empower you to make these decisions about your healthcare, and to understand to the greatest bit that you can about what is happening with your healthcare decisions. And here is the downloadable document that I mentioned to you, questions that you may ask your doctor about secondary hyperparathyroidism and its treatment. Again, a few of these we already talked about, but we want to provide you with these 6 questions that kind of help kickstart the conversation, and again, allow you to fully understand the decisions that are being made by your healthcare team. So with that, I want to thank you again. Thank you for your attention. Thank you for joining today. And I hope that you found this beneficial, and that you learned something, and that you walk away feeling like you have the ability not only to better understand this disease process, but also to move forward in a way that allows you to take your lab results, take the decisions that are being made about your healthcare, and utilize that two-way street with your dialysis care team to make the best decisions for you. So thank you so much. And I am happy to see Aaron. I don't know if any questions have come through, but I will preempt it by saying, obviously I'm thrilled with any question that you put in, happy to address them. What I will say is that we, for obvious reasons, will not be discussing individual cases or individual labs. What I will tell you at that point is to use the motivation that hopefully you have after this conversation, and take your specific personal questions to your dialysis care team. But happy to see if there are any questions that have come through, Aaron. Thanks so much.
Great. Thank you so much, Dr. Dreyer. That was a fantastic presentation, and we appreciate you being here today to share that with us. So we have received several questions. So one individual has just asked how the payment is changing for 2021.
Sure. So without going into too much detail or actual numbers, there is a specific dollar amount that is provided to the dialysis units for each dialysis session. Okay, so each time a patient receives dialysis, the unit or the company receives a flat dollar amount. And that needs to cover basically the dialysis procedure itself, all of the supplies that go along with it. Clearly, it also includes all of the overhead, the staff costs for that particular treatment. And again, I mentioned it does also include some medications that are related to that particular dialysis procedure. So say using an anti-nausea medicine as an example, right? If that is given in the dialysis unit, that needs to be included within that dollar amount. So then there are other medicines that might be given at the dialysis unit that traditionally have been sort of paid for separately outside of that $1 amount that is included per session. Some of those are now being lumped, I would say, included in that one set dollar amount. And so what that is causing is a lot of, I would say, concern about how we include and how we use these medicines going forward given that we have dialysis units have a specific dollar amount that they need to kind of budget for all of these supplies. So changes are being made based on this dollar amount that is used and reimbursed to the dialysis unit per session. I hope that helps.
Thank you. So not an easy answer.
Not an easy answer.
Process there.
It is. It's complicated, and you can understand where the struggles are, right? Because you have to make these budget decisions based on a set dollar amount, right? But at the same time, we also have to keep the patient at the forefront, right? And so we need to inspire that going forward as well, and realize that the patient needs the best medication combination that is exactly right for them. And so that's where we need to see that has to fit within that dollar amount also, right? And we cannot sacrifice that in order to simply meet this sort of square box dollar reimbursement, right?
Mm-hmm. So we have a couple of questions, more generally speaking, about parathyroidism. At what point is the PTH level too high and surgery is recommended?
Okay, so that is a great question. I appreciate that a lot. So let me take the first part of it first, which is, when is the PTH too high? So there are guidelines that are worldwide guidelines that set recommendations based on studies that have been done, based on patient outcomes, based on data that we've gathered over the years. And the current recommendation is that the PTH value be somewhere between about 130 and 600. Okay, so now one of the very important points within the guideline tells us that it is not just a strict cutoff, right? Where if you're at 599, you're okay, and if you're at 601, you're not. What we need to be looking at as a dialysis care team is trends within that 130 to 600. So if you started out 1 month at, say, 200, and we find the next time that the lab is checked, it's at 400, and the next time we check it, it's at 550, we need to be monitoring that and realizing that we need to treat trends within that 130 to 600. That is a very important piece of that. So you may have a PTH that's less than 600, but still requires treatment to keep it there, right? So that's a very important piece. Now, when would surgery be recommended? So there is a surgery, for those who may not be aware, there is a surgery called a parathyroidectomy. So that is taking out the parathyroid glands. There are no specific recommendations on when that procedure should be done. There is no specific PTH value that says if you go above this number, you should consider surgery. Again, that is a very individualized decision between you and your provider. I will say parathyroidectomy is, again, within that same set of worldwide guidelines. Parathyroidectomy is not recommended until after medical management has failed. So preferably your PTH and your secondary hyperparathyroidism would be treated with medicine, and you would realize control of the disease process with medicine. And then if not, you then move to a surgical alternative. But so again, a little bit of a gray answer, but something, if you're nearing that point, I would, again, empower you, do your research and talk to your dialysis care team and your provider about what the best option is for you.
Great, thank you. And how common is secondary hyperparathyroidism? And is it more common in men or women? Is there a difference there?
That's a great question. I do not know with 100% certainty if there is a gender difference. I don't believe that there is. Black individuals tend to have higher PTH values than other populations. It is very common, though. It is very common. Once an individual reaches dialysis or shortly thereafter, it is a very common condition. It is a general extension, I would say, of the loss of kidney function. So there are obviously things that you can do in order to take care of yourself, limit your phosphorus foods, try to pay good attention to your labs. But a lot of times there is a part of it as well that is simply the loss of the function of the kidneys and a loss of, like we talked about with the calcium and phosphorus balance, right? There are things that your kidneys take care of in your body that once they are no longer able to do that, it is a natural extension of that, and part of secondary hyperparathyroidism falls in that category. So it is very common. The majority of patients, as I mentioned, are going to be on phosphate binders, and then the majority of patients at some point are going to require treatment for the PTH component as well for secondary hyperparathyroidism.
Thank you. And can you talk again a little bit more about why somebody might need to take 3 different types of medication?
Sure. So let's start that answer with phosphate binders. So again, the majority of patients, the kidneys clear phosphorus from your blood. If they are not doing that any longer, or at least to a much lesser extent than they were before, there is phosphorus everywhere. There are phosphorus additives everywhere in groceries, in the food that you eat. And so the majority of the time, greater than 90% of patients are going to be on a phosphate binder. So that's the first one. Then, just like we said, the PTH part of it, the PTH target part of it, secondary hyperparathyroidism is also very common. So phosphate binders are only targeting primarily phosphorus. Once you get into the other 2 groups that we talked about, the vitamin D and the calcimimetics, those are going to be more targeted toward PTH. Now, I talked about how each of those works differently. Calcimimetics and vitamin D, even though they both target PTH, they do it in a different way. So a lot of dialysis providers will have what they consider to be their first line therapy, okay? So they will institute or prescribe that product that is their kind of first line therapy for targeting PTH. That may or may not be enough. It might be. And then you may find an individual that is on a phosphate binder and is on a therapy targeting PTH as well. It may not be enough. It may not bring the PTH value down quite enough, or maybe it does for a little while and we find out a little ways down the road that the PTH is starting to climb back up a little bit. In that case, then the next group of medicines might be added in. So it may be that you end up on a calcimimetic and a vitamin D to target the PTH part of it while also being on a phosphate binder. So again, they all kind of work differently, but they all can be utilized safely together in order to attempt to regain that control of calcium and phosphorus and PTH as well.
Great. We have a question from an audience member asking if you're aware of any new PTH drugs that are coming out or are in development.
I am not aware of any that are currently in development specifically to target PTH. That was the question, right? Specifically to target PTH? Okay. Not that are in development or should be coming to the market anytime soon, to my knowledge. We have the vitamin Ds and we have the calcimimetics at this point to target PTH, and that, to my knowledge, is what we will have for the foreseeable future.
And someone is asking if they forget to take their medications for secondary hyperparathyroidism, what should they do?
Sure. So that factors in a lot of times to the treatment decisions about secondary hyperparathyroidism. So as with any medication, if you forget to take it, if you're getting close to the time of your next dose, then you should skip it and take your go back to your regularly scheduled dosing. Also, let your dialysis provider know, let the care team know that you forgot, because a lot of times what we'll find, if it is nearing lab time or something like that, you'll find an impact on your labs. So let your dialysis care team know if you have forgotten to take your medicine. But a lot of times, what we find, some of these products for secondary hyperparathyroidism are administered in the dialysis unit. So if you find that this is an ongoing concern, if you find that you continually are forgetting to take your medicine, if you find in general that this is a problem for you, I know, my goodness, I'm a pharmacist and I'm one of the worst at finishing a course of antibiotics. I find it to be terribly difficult, even though, I obviously know the value of it. So if you find that this is an ongoing concern of yours, again, talk to your dialysis care team about it. There are options that can be administered in the dialysis unit that take that piece of it, that take medication reminder piece off of your plate and put it in the hands of the dialysis unit staff instead. So that is something that you can definitely discuss with them.
Thank you. And we have a question asking if this condition affects diabetes or hypertension.
Okay, interesting question. Not to my knowledge, as a sort of direct and general answer. But that is a wonderful question for you to take, again, to your dialysis care team and discuss your particular case with them. Are there any interactions with your medicines that you are taking for other health conditions that you might have? This is a great way to open that line of communication and be able to discuss the various health conditions that you may be experiencing and how they all intertwine, how they are all treated. And it increases your knowledge base and also shows your doctor, nurse practitioner, your care team, your level of interest in ensuring that you are understanding what's happening and then getting the best care that you possibly can.
Great. Well, thank you so much. Those are some really great questions, and I appreciate you taking the time to answer those for us.
Absolutely. And thanks to those of you who submitted a question. That was great.
Great. If there were any questions that we were not able to address on today's webinar, please email us at info@aakp.org, and I'll work with Dr. Dreyer to help craft a response for you.
Certainly.
We have a couple of closing slides just to go over today with some additional resources that may be of interest to you. We encourage you to join AAKP if you're not already a member. We offer free membership to patients and their family members, as well as living kidney donors. And it's so easy to become a member. You can do it online, or you can give us a call on the phone. And to receive all of the benefits of membership, including notifications where your opinions and experiences are needed to help inform innovation, advance care, and make a meaningful impact to improve lives, please be sure to include your email address when you sign up. We encourage you to respond to our flash surveys and other engagement opportunities that help us elevate the patient voice and change the status quo for kidney disease care. We also encourage you to sign up for any of our 5 different electronic newsletters and subscribe to our printed magazine, AAKP Renal Life. Please also follow us on our blog and on social media for all the latest news and announcements. AAKP is dedicated to helping kidney patients understand their condition and take control of their health care. We are proud to offer a variety of resources for both patients and caregivers, including kidney-friendly recipes and information on related health conditions like secondary hyperparathyroidism. By visiting our website at aakp.org and clicking on the AAKP store button at the top of the homepage, you can find a variety of educational brochures and online tools to order or download. And you can also order materials by calling us on the phone. AAKP's events in 2021 will once again be held virtually with no registration fees. We invite you to join us at our 4th annual Policy Summit coming up on June 17th and our 46th annual National Patient Meeting in September. We also encourage you to visit our YouTube channel to watch presentations from our past events, like our recent annual Global Summit on Kidney Innovations that took place this past May. We'd again like to thank today's speaker, Dr. Deborah Dreyer, for sharing important information about possible treatment changes for secondary hyperparathyroidism. The recording of this webinar will be made available on our HealthLine webpage, and we will be sending around that wonderful fact sheet that Dr. Dreyer referenced. Thank you again to Amgen for making this webinar possible, and thanks to all of you for joining us. Be informed and stay safe.